Hello, everybody. This is Dr. Gregg Hanzlicek, Kansas State Veterinary Diagnostic Laboratory in the College of Veterinary Medicine at Kansas State University. This is a first of a series of videos that we want to discuss the use of antibody titers in our cow-calf herds when there's been fetal attrition. And we're not talking so much about early embryonic death, but more mid to late second, third trimester fetal loss. I think everybody's aware that the gold standards for an abortion workup would be the entire fetus and placental tissue, or a complete set of fetal tissues plus ocular fluid, abomasal fluid, and thoracic fluid, and the placenta. We're talking in this case, we do not have any fetal tissues or placenta available, and the perfect scenario of this would be a veterinarian preg checks a group of spring calving cows in October or November. The herd starts calving. They notice there's animals that aren't springing, that they don't look like they're going to calve. Veterinarian rechecks those animals, and sure enough, they're open. So again, we know we have fetal loss. We just don't have any tissues to submit to try to figure out what's going on. So that's when we're going to use antibody titers. And there's lots of things that we can't rule out because of the lag time from when the fetal loss occurred to when the clinical signs, the preg checking occurred, is so great that there's just a lot of things that we can't investigate. But we believe that by looking at these antibody titers, that we can at least rule in or rule out IBR, the BVDs, and the 5 leptoserovars. And so that's what the subject of this series of videos is going to entail. And we talk about antibody titers. If we could have acute and convalescent samples from the same cows or heifers 2 weeks apart, and we saw a 4-fold increase, that would be tremendously valuable. But again, a lot of times we don't have an acute sample. If we had an acute sample, we would probably have a placenta and fetus. But the fact is that these events occurred in the past, and a lot of times weeks to even months ago. We consider these to be convalescent samples, but we believe that even those single point samples can still be very, very valuable in certain cases. And so there's some steps that need to be done in order to make this antibody titer evaluation valuable. And one is that we need to sample enough animals. One serum sample, and looking at the IBR, BVD, and lepto from that one animal, we can do some things with that, but it's much more difficult with a single animal. We would prefer 3 of a minimum of the open animals. 5 in most cases is a perfect number to sample. If we could get 2 to 3 of the pregnant animals and look at those antibodies, that does give us a little bit of an idea of what the herd baseline level is, but that's an option. So 5 samples or 5 serum samples from 5 of the opens is very, very good. And the reason we need multiple samples is we're going to be looking at trends and patterns within the pathogens across animals. And that's what the series of cases that are coming up, that's what it'll entail. The other thing that we have to look at is, or consider, is the vaccination history. What vaccine was used, and when was the last time the vaccine was administered to this group of animals that we sampled. These are the concern levels for our antibody titers that we've developed here in KSVDL over the last 10 or so years. When IBR titers get up to 128 or higher, then we begin to think that this is probably field exposure and not vaccine or not normal baseline. BVDs, when they get to 1,024 higher, again, that we're going to start thinking, we might have some previous exposure to these organisms. And then lepto, those titers will have to be above 800 before we're going to start considering that the leptoserovars had anything to do with the fetal attrition. And again, by using these guidelines and looking at trends, I think we have a pretty good idea of whether we can rule in or rule out these organisms. So this is just the first step in the videos. We're going to plant more videos case by case, just to show everybody the way that we evaluate titers for the cases that come through our laboratory. We're periodically plant those on our YouTube channel. There's a QR code right down there that you can take a picture with your phone, and it'll take you right to the channel. Highly recommend that you subscribe to our channel, and that way every time that we put in one of these new case study videos online, you'll be automatically pinged and let you know that they're there. So hope to see you down the road, and we can talk more about how to read antibody titers for bovine abortions and fetal loss. Thank you very much.